Hi.
Namaskaram. Hello. I am Dr. Shashikant from Divine Grace Hospital.
Yeah, myself Abel Alex. So we are here to have a small chit chat about our new system which we developed, and we want to share this with you guys about our integrative system.
Yeah.
So Dr. Shashikant will explain the system what we developed here. So it's like a podcast video. So stay with us and see what we developed in this video. Yeah, I
Th-
said.
Thank you, Abel.
Yeah.
So it's very innovative concept where there is something new about this is any stroke. This is mainly about the stroke patients.
Yeah, that
Where
I heard that we developed one system which called Punarjeeva. So
Punarjeeva
yeah,
stroke rehabilitation system with an integrative concept
okay,
of evidence-based integrative concept. It's very unique. See, majority of the hospitals elsewhere, if you see,
mm,
there are hospitals which are primary care, secondary care, and tertiary care.
okay,
So these are three levels of hospitals
okay,
usually. And apart from that, there are other hospitals like Naturopathy Center, Ayurveda Center, or Acupuncture Center, or Moxie, some other centers which are allied healthcare sciences or complementary healthcare.
okay,
See, in our case, what we have done is to find out what is best for this particular patient who have already come out of the stroke, who already had the stroke and
okay,
he's in a recovery time.
uh,
Whatever golden time of the post-stroke is done by allopathy, mainstream, emergency medical uh, available arrangements.
mm,
So once the emergency work is done, all the patient is stabilized, everything is okay,
mm,
stroke is either medically or surgically it is stabilized. So medically we do a lot of medications we use thrombolysis. If it is more bleeding inside, we'll do the burr hole operation or a craniotomy, other operations will do. Once after operation, patient is stabilized.
mm,
So patient cannot be kept in a tertiary care hospital where every day you are charging, 16,000, 20,000, 30,000, 50,000 you are charging every day. So there
uh,
is no actually need till the brain is recovering.
okay,
So post stroke, first 2 months to 6 months is very important.
okay.
In this time, how much inputs you'll give to the brain, how much sensory inputs, motor inputs you'll give.
Okay.
So mainly
So
after the
what is
stroke
motor which you told?
inputs.
Yeah.
So see, after the stroke, patient is having stroke. The part of the brain which is kind of dissolved.
So I think it's the in the block in the brain nervous system, right?
Yeah,
What is stroke?
yeah.
Actually, that is a block in the nervous system.
Stroke is nothing but the blood supply and the brain. Usually they are segregated. They are all separate. So
Okay.
either stroke means there is a bleeding inside the brain or there
Okay.
is a block in the blood vessels.
Okay.
So these two, ischemic stroke and hemorrhagic stroke, there are
Okay.
two varieties, and
Okay.
there are many. Depending on the size of the area, we name it like anterior cerebral artery related stroke, middle cerebral artery related stroke, posterior cerebral artery related stroke. Each one of them has a different area. If the area, each one of the body has a different area, each area has a different parts.
Okay.
So for example, motor cortex of the brain is this side.
Okay.
If stroke is this side, the right hand and the right leg will be involved. So there will
Okay.
be hemiplasia or hemiparesis of the right side.
Okay.
If the right side of the motor cortex is involved, there is a weakness of the right hand or the left hand.
Okay.
Some back of the area is involved, there is a weakness of the speech,
Mm.
like we say Broca's aphasia, or some of the
Okay.
aphasias will say. They understand the patient understand all the language, but he will not be able to speak. So
Okay.
multiple
Well,
complications of the
it's
post stroke.
depending where it's the stroke
Yeah,
happens.
yeah.
Okay.
Where a stroke has happened and which area it is representing. So what is that part of the body which is connected or controlled by that part of the brain, that will be involved.
Okay.
So in post-stroke rehabilitation, majority of the neurosurgeons or neurologists, what they'll do is they'll say, okay, do aggressive physiotherapy, come back and meet me after 3 weeks or 6 weeks or 3 months.
Mm.
What maximum we are doing is, aggressively post-stroke already patient has happened. Patient will be very enthusiastic in the beginning.
Mm.
They'll go for one aggressive 1 month of physiotherapy. Aggressively, somebody will come home and do all the range of movement, strength training program, gait training program, everything they'll do.
Mm.
But the stroke recovery will take at least 6 months of time, maybe.
Okay.
For example, in this 2 months to 6 months, it is very important for the patient to get inputs. We
Okay.
are discussing about motor and sensory inputs.
Okay. So
So,
what is motor and sensory
sensory
input?
inputs. So motor input means if the right hand is involved, we have to do a range of movement exercises, up and down, right and left rotation exercises, and
Oh, it's
change the
like a
direction.
signal which brain gives to
Yeah.
the
So
hand.
so any signal going from the periphery towards the brain is called as sensory.
Sensory.
So information is
The
going from.
reflex is called motor.
So what brain responds to that particular sensation is called as motor.
Okay.
So sensory and the motor signaling has to be increased.
Okay. Okay.
That can be normally it will be increased by an aggressive physiotherapy.
Okay.
But in our case, what we are doing is we are using a medicated therapeutic oil from Ayurveda based on the personality type of the person.
Okay.
Adding exactly what physiotherapy need to be done, we are doing exactly the same. We are not changing anything. We are following the neurologist, neurosurgeons, exactly what we are doing. We are doing the same physiotherapy, but in addition to that, if patient is agreeing, if the neurologist is agreeing, and our therapy module is as such that recovery period will be reduced. So we are using some oils. Oils have a neuroactive terpenes. We call
Okay.
it as terpenes.
Okay.
Terpenes will reduce
So
the
here
stiffness.
we are doing something, the Ayurveda in a scientific way.
Scientific way,
Okay.
evidence based way.
Evidence
For
based.
example, evidence I'll give you.
Not like just orally hearing and doing the
No,
treatment.
not like
So it
simply
isn't like
applying
a
oil.
allopathy research kind of.
It is a retrospective research where first therapy is done.
Huh.
Once the improvement is there,
Okay.
once after the symptomatic score is improved, after daily active living is score is improved,
Huh.
then it is studied back that which has helped.
Okay.
Like physiotherapy has helped, this oil massage application has helped, steam is helped. Like this, we will do a retrospective study.
Mm-hmm.
In conventional medical science, there is a phase 1, phase 2, phase 3, phase 4 trials. But in complementary science or in integrative science, first therapy apply first
Mm-hmm.
and then see the effectiveness. That's what it
Okay.
is. There is a difficulty to convince the reductionist approach mind of a doctor, allopathy doctor, and
Okay.
a
Okay.
holistic approach of a
Okay.
physician. So it is
Okay.
difficult to convince. So we are the bridge between these two people.
Okay.
Major mainstream allopathy people and Ayush people, we are like a bridge.
Mm-hmm.
In this bridge, any amount of questions you want to ask for your patient, you are sending patients to us and you want to ask many questions, you can ask us. For example, the medicated oil we use, Murivenna Taila or Mahanarayana Taila or Karpuradi Taila, some of the medications we'll use. We apply and we'll do a kneading towards the heart direction.
Okay.
When you're applying to this there is a neuromuscular junction, NM junction, or a neuromuscular facilitation. What exactly the physiotherapist is doing is an NM facilitation, neuromuscular facilitation. Each muscle fiber has its own nerve. When you're doing the massage, oleation, all the Purva Karma, Uttar Karma, Pancha Karma, and all they are
Okay.
doing, the strength of those Golgi tendon apparatus, stretch reflex increases, sensory signals will be more. More sensory signals, brain recovery rates will be increased.
So that also I heard that called Nasya in Ayurveda medicine.
Yeah.
That is going to stimulate the nerving system.
So, yeah.
So actually, what happens about that?
Yeah, indirectly you can say that the olfactory nerve,
Ah.
the nose nerve is only this much.
Okay.
So at the base of the nose there is a olfactory glands, olfactory system, and there is a plate of the bone, and on that brain is sitting.
Okay.
So this is the nearest possible junction where you are giving aroma in the form of nasya. You are giving some medicated oil inside the nose. Some dhupam you are giving, dhumapana we are giving. So that medicinal oils can stimulate certain parts of the brain. For example, emotional part, amygdala, hippocampal area, or reticular pathways of the brain, and maybe the patient will feel better, feel good, feel happy. May dopamine level of the patient might increase.
Okay.
Patient feel happy, he will do more aggressively, he will do physiotherapy. Otherwise, he will not be doing.
Oh,
So in
so
that way,
there comes the integrative also.
there is an integration where
Okay.
a feeling of happy, I'm convinced that this is helping me, and I'm mentally able to cope up with that. Therapy is what you are giving. Patient feel happy, and happily you are doing. The improvement rates are much better.
Okay. Okay.
So this is very unique because it is experimented through at least 10 to 14 years of my individual journey with the neurologist, neurosurgeons of major hospitals.
Okay.
So we used to try to convince the doctors saying that, oh sir, this will work, this acupuncture will work, massage will work, this trigger point will work, and all
So
those.
in a integrative way, which we developed the Punarjeeva. I think Ayurveda is there, Panchakarma and physio, and the support of the
Supportive,
medical
yeah,
English medicine, modern
acupuncture,
medicines,
acupuncture also
acupuncture
there.
also.
Yeah.
So the acupuncture usually what they are going to stimulate? Are they going to stimulate the nerving system or
Acupuncture
something muscles?
also, yeah, acupuncture also it will stimulate in acupuncture system of traditional Chinese medicine. It is a belief that it is a meridians.
Okay.
Meridians will get stimulated.
Okay.
Meridians. Same in Ayurveda, it is the srotas. There are
Okay.
channels of energy will be stimulated.
Okay.
But how to convince allopathy doctors? It is we can say that it will stimulate the nerve plexus.
Mm-hmm.
When you prick any acupuncture needles around that area, there will be increased heat generation that can be seen from infrared lights.
Okay.
So that heat generation will be
So
taken as a
actually
sensory input.
acupuncture also really work.
Yeah.
Okay.
It work depending on is it a stiffness or a disease atrophy or it is a Broca's aphasia. We will use
So
under the tongue
here
also.
again the modern English medicine comes.
Yeah, everything is under
Modern.
the guidance of a senior neurologist,
Ah,
and under the guidance of neurologist only we'll take up the stroke patients and
okay.
we'll add the integrative part.
Okay.
Allopathy part will be taken care by neurologist, where there is no,
So that is
kirikiri
what mixopathy and integrative medicine
is a
we, yeah,
difference.
yeah, it
Yeah,
difference.
in
Okay.
our case, we are not giving any alternative to the mainstay of stroke rehabilitation. It will be taken care by a neurologist, taken
Okay.
care by neurosurgeons.
Okay.
But in addition to that, we are adding something which is very useful for the patient to recover fast.
Okay. Okay.
That is our specialty,
Okay.
which is adding the traditional value of Ayurveda system and modern value of medical system.
Okay.
We are integrating both with an evidence base.
Okay.
That is our specialty.
Okay. So you told me that the oils, which is going to help the nerving system. So how that oil help the patient?
Yeah, one way of statement, there is some research which shows that there is something called as a neuroactive terpenes.
Hmm.
So neuroactive terpenes will stimulate the stiffness part, and it will increase the range of movement by at least 15 to 20%. For
Okay.
example,
Okay.
so physiotherapy is adding another 30 to 40%, another 15 to 20% added by oil application. We are getting more range of movements.
Hmm. Hmm.
So
Hmm.
with the application of oil, in
Okay.
that way it is more beneficial.
Okay.
So again, it is a part of idea of a sensory inputs to the brain and motor response of the brain to that area. When you are massaging, those neuroactive terpenes will be activated. It will stimulate that part of the brain to recoup or take up that. So best part of the rehabilitation is
Hmm.
neuroplasticity.
Okay. So what
Brain
is neuroplast?
neuroplasticity means brain, if certain area of the brain is lost because of the bleeding,
Hmm.
the surrounding area will try to encroach by increasing the dendrites activities, axons and dendrites, you
Mm-hmm.
might have heard.
Hmm.
Dendrites will increase, so then it will become so much dense because of the sensory inputs. It will become dense and it will try to take up that part. So one part is weak, other part of the body will become more strong.
Okay.
For example, somebody is blind,
Oh,
his touch will be very sensitive. Here, other part of the
yes, yes.
sensory
Sometimes
system will
is
become very active,
hearing is very
very
sensitive.
active.
Okay.
So, in the same way, neuroplasticity is a brain's adaptability to a deficiency.
Okay.
Some part is not working, other part will become overactively work.
Okay.
For this help, neuroplasticity, there are thousands of examples where you can search from PubMed journal, Cochrane reviews, and other centrally well acclaimed journals. You can find out that integrative concepts are useful. So
Mm.
what we do is we don't reinvent the wheel. We
Okay.
only take out of all these research activities which is best.
Yeah.
Okay, these
We add on it.
for example, these 10 acupuncture points are good.
Ah.
We'll take that and we'll apply.
Okay.
In some of these medicated oils are very good in this.
Ah.
We'll take that and we'll apply under the guidance of respective doctors.
Okay.
In allopathy, respective neurologists will be there, neurosurgeons will be there. We have a top 5 neurologists of Bangalore.
Okay.
And adoptive other alternative practitioners also there. All the alternative practitioners, conventional medical practitioners, Ayurveda doctors, acupuncturists work under the guidance of senior neurologists.
Okay.
In that way, we are special in giving our integrative specialty for stroke, post-stroke
Oh,
rehabilitation.
which we named it that Punarjeeva.
Punarjeevan. Yeah.
Okay.
Okay.
So thank you, doctor,
Thank you very
for
much.
explaining these things.
Thank you.
And usually people don't know what is integrative
Yeah.
medicine, and people think that it is like mixopathy.
Simply
So this
somebody
is the
massage and all.
difference, and which we developed past 5 years in this hospital, and we researched it. It is our personal data analyzing, and we see that only Ayurveda we tried it for the stroke patients, but when we try this integrative medicine, there is a huge difference
More
for the
effective.
development for the patient.
Yeah.
So thank you for the
Thank
time,
you. Thank
and
you very
thank you
much.
for thank you, doctor.
Thank you very much.
So see you in next video. Thank you.